today. He is expected to talk about some of Canadians, the most vulnerable Canadians in the midst of this pandemic. Specifically, we are hoping to hear more about help to for food banks and other groups. So that's still to come at around 11:15. The Prime Minister and the government is also under some growing pressure to release so-called modeling data on how many Canadians could get sick from COVID-19, how many could possibly die. The Prime Minister said that some of those numbers will be coming out soon, that they are working on the analysis of the raw data, which is readily available. But we'll hear some of those hard numbers next hour from public health officials in Ontario. Premier Doug Ford says the provincial projections may indeed be difficult to hear. He calls them grim. CBC News, though, has obtained some of the information that we will start to hear next hour. And the CBC's Mike Crawley, who covers Queen's Park for us, is in Toronto and joins us there. Okay, Mike, tell us what you know so far.
Rosemary, what I've learned from my sources is that the measures that Ontario has taken so far, these projections are going to show that, in fact, the physical distancing measures, the state of emergency, the closure of all of these businesses has prevented hundreds of thousands of cases of COVID-19 happening over the course of the coming month, and by doing that has also prevented thousands of deaths. And so these projections are also going to show, though, in the coming weeks, if Ontario does not take stricter measures right away, a couple thousand more people could still die. So in other words, if you look at the other side of that, if Ontario does impose even stricter measures today, immediately, the projections would suggest that hundreds more lives could actually be saved.
Okay, and we are expecting, sort of an explanation around the modeling at noon. We're going to talk to a doctor shortly because these are projections. It doesn't mean that this is the outcome that has to happen. They are ideas of how it will, they think it might happen at this stage. Just to couch all those things a little bit, Mike, can you tell us anything about why there has been this shift in the Premier's thinking around releasing the data? Because, there was a point earlier this week where he wasn't sure he wanted to, and then yesterday he was quite definitive about it.
Well, in fact, it's been epidemiologists, the people who study the pattern of how the disease spreads, that have been pushing Ontario, pushing the province to give them more raw data about what's been happening so far, because the only way that they can make these projections is by seeing detailed information about how many people are contracting the virus, when did they contract it, how many people are being admitted to hospital. And it's been a little bit like pulling teeth to get that information from the Ontario Health Ministry. Plus there's been this disadvantage that because Ontario's testing regime was not as widespread as it could have been, and also because of so many delays in the tests, the data wasn't very good. So the epidemiologists couldn't really come up with these projections. Now, Premier Ford is talking about this stuff as, the province's projections. That work is being done by experts in public health, experts in epidemiology, who work at, in fact, some of the institutions that are behind me, sorry, on that side. University of Toronto, there's a School of Public Health affiliated with the University of Toronto that's just behind me here in Toronto. They have been wanting to crunch these numbers, and so the information that is going to get released by the province is actually the work of epidemiologists based on this provincial data. Now, I believe that the data has now been more fully shared with these scientists, but there's still a desire to have more accurate, more up-to-date information to come up with these projections.
Okay, Mike Crawley, we will come back to you if you get more information, but thanks for bringing us that breaking news. Appreciate it. CBC's Queen's Park reporter, Mike Crawley, he's in Toronto. We are awaiting, of course, the briefing from public health officials. That will be at noon here in Ontario, and we're going to bring it to you as part of our special coverage today because of the importance of those numbers and the importance to the audience, obviously. BC has already done this, and we did give you full coverage of that as well. So instead of going to cabinet ministers federally here today, we will instead go to Ontario. Ontario. Doug Ford, the Premier, will speak at 1:30 Eastern. First, though, let me go to Dr. Isaac Bogosh. He's an infectious disease specialist at Toronto General Hospital, and you probably know him well now as a regular contributor to CBC News. Doctor, so I'll just get you to react to what Mike told us there. It is not obviously specific numbers. It is trends that seem to suggest that, one, what Ontario is doing has been working, but more needs to be done. What is your reaction to that?
Yeah, I think that's hopefully that's the message from Premier Ford. I mean, we've heard him speak yesterday talking about radical transparency with the data, with the figures, with the projections. I think that's definitely the right approach. There's no point sugarcoating everything. I think the citizens deserve to know exactly what we're in for. And you know, he also used words saying, you know, there might be some stark figures. He said it's going to be a sobering discussion. These are his words, and I think that's completely fair. We need to know what we're up against. We need to know how we're doing, and we need to know what we need to improve in order to really protect people in this province.
Tell us the disadvantages of epidemiology modeling. What are the things that it can't do?
Well, I mean, models are really, you know, of course there's going to be strengths and there's going to be weaknesses with the models, and there's going to be certain assumptions, for example, that you make with models. So there might be some, you know, degrees of uncertainty with many of these projections, and that's okay. That's expected. This is not a crystal ball, but it does tell you you know, within some range of certainty where you're going to land. And it, you know, I think it's extremely important that we know what that is. This is the kind of situation where I think more information is better. But of course, it's not just more information. It's more information placed in the appropriate context. So let's not just discuss what the numbers are. Let's just not just discuss what the models project. Let's talk about the strengths and the weaknesses of the models, and then how we translate that data and interpret that data and place it into our day-to-day lives. What does this actually mean for us? Are we doing a good job with our physical separation? Do we need to do more physical distancing? Do we need to take additional measures to prevent transmission in community settings? You know, these are the important questions that I think will be addressed at the meeting, and I look forward to it. I mean, I don't think anyone would be opposed to radical transparency in a time like this.
Yeah, no, you get no argument from a journalist, that's for sure. Okay, Dr. Isaac Bogosh, I'm going to leave you there for a moment. We'll come back to you if we have time. Dr. Isaac Bogosh, an infectious disease specialist at Toronto General. I just want to bring in my two colleagues as we wait for the Prime Minister to come out in about 7 minutes' time. Power and Politics host Vashi Kapelis and the CBC's Catherine Cullen are here. There's a couple other stories and parts of this story that we are tracking. I'll start with you, Vashi, just on the federal government's response to some ongoing pressure for more information. Should point out that their information is entirely reliant on the province's information. So there is some dependency there in terms of how much they can give and what they can give. But there are calls for the federal government to do more.
Yeah, there have been calls all week, and the Prime Minister responded yesterday by saying that the analysis of that raw data that you pointed out is readily available would be coming soon. He would not qualify what soon means. We don't know how quickly that information will come out, but it's in a sense mirroring what we will see from Ontario. So it's the same idea. They're getting the same questions that Premier Ford was earlier this week, and that is, can you provide for us, as Dr. Bogosh pointed out, not just the raw data, but place it into context? What does the modeling show? What are the various scenarios based on the actions that have been taken so far? The Prime Minister continues to point out that those scenarios will definitely be impacted on the behaviors that we exhibit, how closely we observe the rules related to physical distancing, for example. But again, the pressure is on the federal government to release those numbers. I would point out, as you said, that a lot of that sort of analysis depends on the raw data that they get from various provinces. Some provinces, like Ontario, have that data ready to produce, or the analysis of it today. I spoke with Blaine Higgs, the Premier of New Brunswick, last night, and he won't have enough cases in his province until next week to provide to the federal government. So that gives me a sense of maybe when we might be able to get the models, or when the federal government will be willing to provide the models. If they don't yet have data, for example, from New Brunswick, it might be hard to paint a countrywide picture faster than they're able to get that. So I think timeline definitely continues to be an issue for the Prime Minister. I imagine, based on the numbers and the modeling that we're going to hear from Premier Ford, there will be more additional questions for the federal government where that's concerned.
And we know that it came up in the conversation last night too on that call with the premiers that the Prime Minister had. I want to switch gears if I can and talk about another issue, and this around personal protective equipment in relation to something that the White House is trying to do with the private company 3M, who is probably the biggest producer of N95 masks, those high-grade medical filtering masks that are used in hospitals that are so critical during a pandemic. And for that, I'll go to Catherine Cullen. This is sort of an odd story, but one I'm sure that the Prime Minister will get asked about too, Catherine.
Yeah, 3M in the United States, Rosemary, putting out a statement today that is to some extent sounding the alarm in terms of what is happening with its N95 masks. In this statement, 3M says that the U.S. has invoked the Defense Production Act, and it's going to require that 3M prioritize sending those N95 masks to the Federal Emergency Management Agency, to FEMA. So basically, 3M masks produced in the States, they have to go to U.S. needs. But in the statement, 3M goes on to say that the administration has also requested, and I do think the word requested rather than required in this sentence is important. 3M has requested, or the administration has requested that 3M cease exporting those masks that they currently manufacture in the United States to Canada and Latin America. 3M says that they think there is a significant humanitarian implication if they decide to do that. They say that they are a critical supplier of these masks in Canada and in Latin America. They also note that if 3M stops exporting things, that other countries might retaliate, and that they feel that in the end, for the United States, they could be worse off. They would actually have access to fewer masks. Now, this is all part of a bigger picture, Rosemary. There's also a story out of the Associated Press today, again dealing with masks produced by 3M. Quotes a German official saying that the U.S. is employing what this official calls Wild West methods, that there were actually hundreds of thousands of masks destined for Berlin police. They were changing planes in Thailand, and the U.S. managed to somehow reroute them.
Wow.
We should say, though, in terms of the Canadian context, we know that there's been an ongoing discussion about provinces that are particularly in need having enough personal protective equipment. We know from our provincial sources that the conversation last night involving the Prime Minister and the premiers, that all the provinces agreed that the provinces that are most in need right now should have priority access to federal supplies. So if there are provinces, and we know that there are, that are talking about perhaps only having a few days worth of supplies left, they would be the ones at the front of the queue right now. But certainly the Prime Minister will face questions today about what the implications are of moves like this and what Canada can do to try to essentially convince the U.S., frankly, to share.
Yeah, I guess there's some questions around whether the Defense Act that the United States has is using in order to help along procurement in that country could force the hand of 3M in the United States. There is a statement from 3M Canada in relation to this, saying that they are aware of the memo from the President of the United States and, quote, our primary concern remains the safety of healthcare workers and first responders during this crisis. They are looking at every possible way to meet domestic needs for Canada. So there is a 3M Canada, so they have responded to this latest move by the United States and the response from 3M there as well. And I'm sure the Prime Minister will get some questions about that. Before we see the Prime Minister come out of his house there, just some other sad news. There are four more people have died in Bobcaygeon in the Pinecrest Long-Term Care Centre. So that is a total now of 20 residents who have died in the Pinecrest Nursing Home. And I believe one volunteer. We talked to one of the doctors who was an attending physician there a couple days ago. This was what he feared, that this would continue, and certainly it is the fear of public health officials that once this virus gets inside these vulnerable communities with limited capacity for isolating people, that it is hard to prevent fatalities. So again, 4 more dead in the Pinecrest Long-Term Nursing Home in Bobcaygeon, Ontario, as we wait for the Prime Minister to come out his front door. Vashti, maybe I'll just go back to you on this issue of equipment and how the federal government navigates this with the United States.
Yeah, this is a really tough one, Rosie, and I think that, as Catherine points out, there was already a backdrop against which this is all happening, and that is the sort of need for supplies in this country. We had been talking all week about how various provinces have various needs, and some, including Quebec, which we're seeing a huge need just based on the number of cases there, is saying that there's only days left until they run out of some of these crucial supplies. This further complicates things. We had also been hearing about increased competition around the world. That report from the Associated Press of literally supplies being cut off to be shipped to the United States is an additional additional layer to all of that. And then when you bring in 3M, I mean, even the statement from 3M that you read out, Rosie, I mean, there's some will there, obviously, but how, I think the question is, how are they able to continue distributing, for example, N95 masks in Canada in the face of the president invoking this act? I don't know what the answer is yet. It sounds like they're not even sure how it will play out. They plan to, and they raise the issue of, the humanitarian questions that it raises if they stop distributing things like that in Canada. But we have not, the law was created in 1950. It's a wartime law. How does it apply in this context? What kind of impacts might it have on Canada? I know from my conversations with people who work for the Prime Minister that they are seized with this issue. They are concerned about the possible impact.
All right, thanks, Vashi. Here is the Prime Minister of Canada.
Before we get into things, I have two pieces of news to share with everyone. The first one is about the distribution of critical equipment to provinces and territories. For the past few weeks, our government has been working closely with industry to produce the supplies our healthcare workers need, like masks, face shields, gowns, ventilators, and test kits. Well, today I can announce that our government has signed an agreement with Amazon Canada to manage the distribution of this equipment to the provinces and territories. Aujourd'hui, j'annonce que notre gouvernement a conclu une entente avec Amazon Canada pour acheminer du matériel médical aux provinces et aux territoires. Amazon utilisera son grand réseau de distribution pour assurer la livraison d'équipements médicaux là où on en a le plus besoin. La deuxième nouvelle dont je veux vous faire part ce matin est en lien avec l'armée. On a reçu une demande du gouvernement du Québec pour une intervention des forces armées pour prêter main forte aux communautés nordiques et isolées. Comme je l'ai dit plus tôt cette semaine, nos membres sont toujours prêts à...
Our members are always ready. COVID-19, so I can confirm that the Canadian Armed Forces will be there for...
Depuis quelques semaines, la COVID-19 chamboule les vies. On fait l'école à la maison, on réduit nos déplacements, on reste chez nous le plus possible. On vit tous les conséquences de la pandémie, mais certaines familles traversent des moments encore plus difficiles et plus incertains. Si vous avez perdu votre job, si vous ne recevez plus votre chèque de paie, vous vous demandez non seulement comment vous allez payer vos factures à la fin du mois, mais l'épicerie le lendemain. Across the country, there are food banks that can help. But like most organizations, food banks are facing new challenges because of this pandemic. With everyone staying home, they have fewer volunteers. And a difficult economic climate means that they're receiving fewer donations that they normally would, while demand rises. The staff at the Neighbor to Neighbor Food Bank in Hamilton told us they're getting more and more calls. And it's overwhelming for the volunteers who are spread really thin and working overtime to help their community. The work being done by food banks and their volunteers is essential, so there's no question that they need more support during this crisis. If you have the time and ability to help, reach out to your local food bank and ask them how you can help them. At the same time, I'm announcing that the government will provide $100 million to meet the urgent food needs of vulnerable Canadians, including those living in Indigenous and Northern communities. This money will help ensure that organizations can buy and deliver food to those who need it the most. It will help support organizations that you may already know, like Food Banks Canada, Breakfast Club, and the Salvation Army, and many more. And on that note, I do want to take a moment to thank all volunteers and organizers. Thank you for feeding our communities. We see you, and we are grateful for the incredible, tireless work you do, even in these extremely difficult circumstances, especially in these extremely difficult circumstances. You are doing essential work for our most vulnerable. You are showing what it is to be Canadian, to be there for each other in times of difficulty.
Today, I am announcing that the government will invest $100 million to meet the urgent food needs of the most vulnerable, including people living in northern and Indigenous communities. This money will help food banks to buy and deliver provisions to those who need them. Since the beginning of the pandemic, food banks have been facing specific challenges. For example, most of their volunteers are people who are retirees and who are more at risk of being infected. That means fewer people to serve a larger clientele. Food banks and charities are doing an incredible job in our communities, and they do so all year long. I'm thinking of the town of Villeray that I'm familiar with, where people are working very, very hard to help their neighbors in my riding of Papineau. If you have the time and the ability to help these days, I invite you to get in touch directly with these organizations in your neighborhood. They need your help. And with today's announcement, we are supporting a number of organizations that you may already know, such as Moisson Montréal, the Baked Breakfast Club, and the Salvation Army. And in fact, I want to take this opportunity to thank all the volunteers and organizations for their excellent work. You are feeding our communities, and we very much appreciate everything you are doing. It's not easy. There is a great deal of demand. You're limited in terms of your resources, but I know that you will continue to help your neighbors and to help people who need help. That's what we do at difficult times. We're there for each other, and we will be there for you. I know there are many of you who are going through difficult times. The pandemic is creating a lot of uncertainty, and you're worried. But I want you to know that our government will not abandon you. We are investing in food banks so that you can meet the urgent needs of your family during this crisis. And at the same time, we are offering financial assistance to people who've lost their jobs or their paychecks because of COVID-19. We are introducing the Canada Emergency Response Benefit that will give you $2,000 a month. Our government will also increase the GST credit to help people whose income is low or modest. We said that adults who are eligible would receive up to $300 or $150 per child starting in May, but I can now confirm that they will receive that help this month in April.
Our government is also supplementing the GST credit to help low-income people. We had said that in May, every qualifying adult would receive up to $300 with $150 for each child, but I can now confirm that help is coming sooner, this month, in April instead. Our government has also been working with major banks to deliver benefits, including the CERB, through direct deposit. Effective today, people should visit their bank's website for information on how to enroll for direct deposit if they haven't already. Je sais que vous êtes nombreux.
I know that many of you would like to know how much time this will last. You're wondering when you're going to be able to see your friends, hug your grandparents, or have people over for dinner. Last night, I had a discussion with the premiers of the provinces and territories, and we talked about data sharing and projections. The good news is that many more people are being tested, and experts have new data to analyze. The provinces and territories are now updating their information and will be publishing the latest data very soon. On our side, we're working very hard to verify the latest figures so that we can put them online. You can consult canada.ca/coronavirus to get the best information, updated information about the spread of the virus. I'd like to be able to tell you exactly when all of this will be over. I often talk about weeks and even months, but the reality is that it will depend on each of us. The best way to minimize the impact of COVID-19 is to continue to follow public health directives. You know them. Stay home as much as possible. Limit your movements. And if you absolutely must leave home, keep a distance of 2 meters from other people. Continue to do your part, and I promise you we'll come through this. I'd like to close today with a message for young people and children. On Sunday, I will be holding a video conference on you with Dr. Tam. You can send me your questions today at the Radio-Canada website, and I will be looking forward to answering your questions on Sunday.
On Sunday, I'll be holding a video conference focused on you with Dr. Tam. So send me your questions through CBC Kids websites by the end of the day, and I'm looking forward to answering you this weekend. Merci beaucoup tout le monde.
Thank you all very much.
Thank you, Prime Minister. We'll now go to the phone lines for a few questions. One question and one follow-up. Operator.
Thank you. Merci. First question, Kate Bolingaro, Bloomberg. Your line is open.
Hello, Prime Minister. I have a question regarding the OPEC. Canada to meet with has been invited to meet with the party and talk to.
I'm sorry, Kate, your line is cutting out a little bit. Can you try and speak closer to the phone and a little more clearly?
Yes, no problem. Can you hear me now, Mr. Prime Minister?
That's much better. Thank you.
Okay, so my question is regarding the OPEC Plus meeting on Monday. Is Canada planning to meet with, has it decided to meet with, or is it already talked OPEC other oil producing nations about coordinating output levels to help bring crude prices down? And what would you want to potentially look like?
I can assure you that we've been coordinating closely with the United States and other allies in looking at the challenges faced by OPEC right now. We recognize that these catastrophically low oil prices are having an impact on many people's economies and indeed on Canadian oil sectors. We're trying to coordinate to ensure that we make sure that our economy doesn't face the kinds of challenges that it's been facing. We need to continue to support workers across the country. We will continue to work internationally to try and impact on the difficult decisions made by OPEC over the past weeks, and we will keep you posted on that.
And what is happening with the support package for the oil sector we've been hearing about?
We're continuing to work with provinces, with particularly the province of Alberta, to ensure that we're giving support to workers who are in particularly distressed industries. The wage subsidy and the Canada Emergency Response Benefit will be of help to people right across the country, including in the oil sector, but we recognize that certain industries are facing much greater stresses than others, and we will continue to work with the provinces. I can highlight that in our conversation last night, the premiers and I did discuss this. I heard directly from Premier Kenney and others on the importance of support to the oil sector, and we're going to continue to work with them.
Thank you. Operator, next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Good morning, Mr. Trudeau. We are hearing that the U.S. administration has asked 3M to stop exporting N95 masks to Canada. Can you give us more details about what you know? Were you aware of that decision? And how will Canada respond to it? Well, we are working very closely with the United States at this time so that they understand what we already know very well, which is that trade between Canada and the U.S. goes in both directions, particularly when it comes to essential goods and medical personnel. There are thousands of nurses in Windsor who work in Detroit every single day, and Americans depend on them. There are medical products and other essential goods that move across the border in both directions, and it would be a mistake for both of our countries to limit access, either one's access to goods and essential personnel. That is exactly what we are pointing out to the U.S. administration, and we will continue to work to ensure that what we need will arrive.
We've been working very closely with the Americans to highlight what Canadians know very, very well, that the level of integration between our economies goes both ways across the border, that we are receiving essential supplies from the United States, but the United States also receives essential supplies and products and indeed healthcare professionals from Canada every single day. I think of the thousands of nurses, for example, who cross the bridge in Windsor to work in the Detroit medical system every single day. These are things that Americans rely on, and it would be a mistake to create blockages or reduce the amount of back and forth trade of essential goods and services, including medical goods, across our border. That is the point we're making very clearly to the American administration right now.
And a follow-up, Melanie?
Yesterday, Mr. Trudeau, you were supposed to follow up with Washington with respect to the fact that masks are being diverted. And I just want to come back to whether Canada will respond and not send masks to the United States. I can tell you that we will continue to keep trade open with the United States. Both of our countries depend on that trade in essential goods and services on both sides of the border, and we will ensure that that continues to flow and encourage it in these times of difficulty. Of course, we will be following up on concerns about shipments that have been diverted, but at the same time, we continue to receive what we need.
Thank you. Next question, operator.
Thank you. Merci. Next question, Tonda McCharles, Toronto Star. Line open.
Tonda, you might be on mute.
Yeah, I am. Sorry. Thanks for taking the question. Can you clarify? Last night, this order came from Trump to 3M company to cease their exports to Canada, and you've talked about how valuable it is. But have you, since then, put in a call to the president? Do you have one planned today? And you said it would be a mistake, but it's a done deal, is it not?
3M has indicated that it understands how important it is to continue with delivering on orders to places like Canada, because there is much trade that goes back and forth in essential services, and it could end up hurting Americans as much as it hurts anybody else. That is the point that we are making very directly and have been making for many days now to various levels of the American administration, and that message is getting through.
3M has said that it would be a mistake to limit trade in essential materials because all countries need to receive those supplies from beyond their borders, and it would not be advantageous for the United States or Americans if supplies from Canada and elsewhere could not come in. So this is something we are pointing out forcefully with the U.S. administration right now, including this morning.
Sir, you didn't indicate whether you have or will speak to the president today, but I'd like to understand from your perspective just how big a gap this leaves Canada's supplies of these crucial medical masks.
We continue to be confident that we're going to receive the necessary equipment. We understand that there are pressures across our healthcare systems in various regions on the dwindling supplies. That's why we are working so hard to ensure that we get the right supplies to them in the right amount of time. We've seen a number of Canadian companies stepping up their productions, which will be flowing soon. We're also receiving more shipments from places around the world. We will do everything we can to ensure that no part of Canada goes without essential supplies in facing this pandemic.
Thank you. Operator, one more question on the phone, please.
Thank you. Merci. Justin Ling, freelance. Your line is open.
Hi there, Prime Minister. You've been imploring people to stay home if they can. You've been asking people not to go to work. But given that, why are you still sending in civil servants to run immigration detention facilities when that could seriously increase the risk of spreading the virus not only to those detained in the facilities, but to those workers who have to go back home to their families every day? Do you consider that an essential service to be locking up people who were applying for asylum here?
We recognize that there are many essential services that need to continue to be delivered for Canadian safety, for the well-being of our country, and ensuring that Canadians are safe needs to be a top priority. That's why we're going to continue to ensure that essential services get done wherever possible. Civil servants are encouraged to work remotely, to work from home. We know there are significant things that need to be worked on to deliver for Canadians, to keep Canadians safe at this particular time. And I want to take the opportunity again to thank the public service for all it does in these difficult times to make sure Canadians are kept safe and secure.
Well, it's not really a question of safety when you're locking up those who may have overstayed a visa or who applied for asylum. And certainly, it's been 2 weeks now since I first asked you about releasing nonviolent offenders, and nothing has happened. Your government has continuously said, you're looking at it, everything's on the table, you're looking at it, but nothing's actually happened yet. Why are you dragging your feet, and why has action not been taken yet?
I can actually inform you that action has been taken. We've been working closely with Corrections Canada and detention facilities of all types to reduce the vulnerability to the spread of COVID-19, to ensure that measures are in place to keep Canadians safe. We continue to look at other measures that can be taken, and we will take those measures in due course.
Brian Mullen, Global News. Prime Minister, on the issue of 3M, you're saying if the U.S. goes ahead with this, it could hurt Americans also because of the flow of supplies and resources across the border. Are you considering any retaliatory measures against the U.S.?
We are discussing very closely with the United States the importance of keeping the flow of essential goods and services across our border to help both of our countries. I am confident that the close and deep relationship between Canada and U.S. Will hold strong, and that we will not have to see interruptions in supply chain in either directions. We
will continue to point out to the Americans that it is in the interest of our two countries to continue to share essential goods and services. This is very important for all of us, and that's why I am confident that we will be able to continue to rely on each other in the midst of this significant crisis.
Prime Minister, within the hour, Ontario officials are going to reveal their projections on the number of cases and the number of fatalities we might expect in the province. Dr. Tam has said the federal equivalent of those models are being used to inform your policy decisions, require Canadians to dramatically alter their way of life. Don't you have an obligation to follow Premier Ford's lead and release projections on the worst case and best case scenarios about how many of us might die?
We have been releasing information every single day on data received from the provinces, updating it regularly on websites so Canadians can see the latest numbers and look at various models that use those numbers to make various projections. At the same time, we need to make sure that the projections that we will be releasing are based on the most accurate, the deepest, the most properly collated information out there. We are working with the provinces to be able to build a robust model to give the projections that people want to see. People are wondering, how much longer is this going to last? How many Canadians are going to be severely affected? These are things that we will be sharing with Canadians, but we need to make sure we have a better grasp on the accuracy of the data before we put projections out there. Nous reconnaissons que les Canadiens veulent savoir combien de temps ça va prendre, qu'on va devoir continuer cet isolement, combien de Canadiens vont être affectés, combien il y aura de décès. Nous allons partager cette information,
sharing that information. But before we can do that, we have to base ourselves on very specific data, precise data, and better than the data we have now. And that's why we're working with the provinces to look more closely at that data and analyze it so that we can deliver a model that is much more focused on reality.
I I just want to return to the OPEC questions you were asked at the top. Can you clarify, is Canada at the table at Monday's meeting, or are you just dealing with the U.S. and the U.S. is the one dealing with OPEC?
Okay. We are continuing our conversations with the international community, including with OPEC. There have been communications between OPEC and Canada. We will continue to stress that we need to work together as a world to get through this economic crisis as well as a health crisis. We will continue to insist on that.
Okay, can you please clarify if that means Canada will actually be at the table? And also, I'd like to get your thoughts on whether Canadian producers should actually be cutting their production further. They've already had to do this. More is expected because of supply challenges. So is it a wise strategy for Canada to coordinate with a price-setting cartel that has caused many of the current problems we're seeing in the global pricing of oil?
Well, I can assure you that conversations are ongoing with the United States on how we can work together to ensure that we are countering some of the measures being brought in by OPEC, and we will continue those conversations.
Bonjour, M. Trudeau. Mathieu Goyer de Radio-Canada.
Radio-Canada.
On comprend que ce sont les Rangers qui vont aller dans le nord du Québec. Pouvez-vous donner plus de détails sur
Will
leur
they
nombre et leur
be the
mission
Rangers
particulière?
in northern Quebec? Can you provide more details on that? We know that the Canadian Rangers are always present in the north to help communities there and to serve. What I understand is that the Rangers will be in Inuvik to help them install tents and other medical infrastructure, and we'll have more information on numbers in the coming hours. Now, pharmacists are thinking that they may have a shortage of certain critical medicines, such as morphine. How can you ensure that supplies will be there for the hospitals? We have a very good pharmaceutical system here, and the companies have been told to produce more material and medicines that we will need during this crisis. So we want to ensure that there won't be a shortage in hospitals, and we will continue to monitor the level of resources available so that no hospital and no Canadian is lacking the necessary medications.
Minister Olivia Stefanovich, CBC News. I imagine you have seen the projections from Ontario and Quebec that will be released shortly. Can you tell us what your reaction is to those numbers and how this will change the federal approach?
I'm not going to preempt the announcement that Premier Ford is going to be making shortly. We have seen the numbers. We continue to work very, very closely with the provinces. We are very much looking to share national projections with Canadians in the coming days. But I can tell you that we know that this is a very difficult situation for Canadians. There are some very challenging projections out there that will emphasize how important it is for all of us to do our part, to stay home, to keep ourselves safe, to keep our loved ones safe, and to get through this as best we possibly can.
How do these numbers change the federal approach?
Our federal approach continues to be to do everything we can based on the best scientific advice to keep Canadians safe and to ensure that our economy bounces back strongly after this is all through. The measures that we're encouraging and asking Canadians to take, whether it's around self-isolation, whether it's around social distancing, which means keeping 2 meters apart, whether it's around ensuring that people are washing their hands regularly and for 20 seconds. These are the things that are going to help keep Canadians safe. As much as we can do at the federal level, as much as we can support, as much as we can bring in quarantines and decrees, ultimately, it is Canadians' own behavior that will make the difference in this. How we get through this depends on you, and that's why I'm so confident that we will get through this, because Canadians are always there for each other. We're looking to do the right thing. We will get through this together. Merci tout le monde.
All right, that is the Prime Minister of Canada speaking to Canadians for his daily briefing on the fight against COVID-19, both economically and from a public health perspective. Just an update on the information we are expecting from Ontario today around some of the projections and modeling that they have done. That press conference has now been pushed back to 12:30 Eastern. We will bring it to you live, but we will also now bring you at least part of the federal government's briefing, which will start at noon. Before we do all of that, Let me go to my colleagues, Vashi Kapelis and Catherine Cullen, who have been listening in there. The Prime Minister making two announcements, but it's probably the content of the questions and answers that I want you two to talk about. From the announcement perspective, confirming that Amazon Canada will be helping the federal government get supplies out to provinces and territories. And secondly, confirming what we had been reporting, that the Rangers, part of the military, will be going up into northern Quebec to help out after a request from that province. Okay, let's get to more of the meatier stuff. Oh, and the food banks. Geez, $100 million, $100 million. How quickly I forget. $100 million for food banks across the country, and some remote Indigenous communities. So a significant amount of money to try and bolster supplies for Canadians who may be using the food banks more. Vashi and Catherine. Vashi, I'll start with you. There was a lot of stuff there in the questions and answers. Perhaps we'll start with the 3M supply issue with the president.
Yeah, I certainly think that's probably the biggest headline today, the biggest story today, and probably the biggest concern for the federal government at this moment. The backstory is that 3M, which manufactures N95 masks, which of course are the masks that healthcare professionals need in order to guard themselves against the spread of the virus while they're helping all of us deal with the virus, and they help treat the virus. The Defense Production Act in the United States, the president has invoked it in order to make sure that 3M, or to ensure from his perspective that 3M only produces those masks and only ships them to the United States, and in fact has specified that they not go to Canada anymore. Now, we don't know the exact sort of details on how many masks we are importing from them or where they're coming from. My understanding is that none are made. There's an earlier statement from 3M that a producer we work with found for us that shows that the masks are not produced here in Canada, but they have doubled apparently in the amount of N95 masks brought into Canada in the first 3 months of 2020. So it sounds like this would affect our supply in some sort of significant way. Now, the Prime Minister was asked, so what are you doing about it? Are you talking to President Trump? What are the conversations like? And he said that he didn't specify that the conversations had been had with President Trump, but he did say that in not, I wouldn't say an explicit threat, but he highlighted a few things about the relationship between the U.S. and Canada that almost implied a bit of a threat. And I use the word threat not in a specific way, but he said that trade goes in both directions. He highlighted the fact that 1,000 nurses in Windsor work in Detroit every day, and that Americans depend on those nurses. It would be a mistake, he said, for both of our countries to limit access to goods and essential personnel, and that's what we're pointing out to the U.S. administration. So we don't have any concrete answers yet on what comes of those conversations or if the U.S. will pull back on this. But certainly it sounds like the conversations are being had, and the Prime Minister or others are pointing out the interdependence of the relationship when it comes to essential goods and healthcare workers.
Yeah, it's so interesting to see the sort of constant strain this relationship seems to be under in the midst of this pandemic. Whether it be the threat from last week around bringing the military closer to the Canadian border, which now seems to have died off, to closing the border and finding a way to do that in terms of non-essential travel, and dealing with an American president who is, certainly protectionist and has been, even though they managed to sign an agreement on NAFTA. Before I go to Catherine, I'll just show everybody this tweet from Doug Ford, who's going to be speaking shortly, but he has also obviously been concerned with this, and he reached out to the trade representative of the United States, Robert Lighthizer. I don't know if I have that tweet. Maybe it'll come up. Okay, because I've
got it right here, Rosie, if you want me to.
Okay, you read it and we'll bring it up. Off you go.
I just got off the phone, Doug Ford says, I've just got off the phone with Ambassador Lighthizer regarding the U.S. government's new order. The health and well-being of our frontline workers depends on these essential medical items, and now more than ever, our countries need to work together to combat COVID-19. So that message of working together, which was certainly part of what we heard Justin Trudeau saying, but the other part of it, as Vashi rightly acknowledged, is that question of is it a polite threat? Is it an implicit threat? Is threat the right word? I think that's up to the audience to judge, but where he said rather clearly, these are things Americans rely on. It would be a mistake to create blockages. I think it's also important to note, because obviously that kind of news is going to raise some concerns amongst Canadians, that the Prime Minister did say we continue to receive what we need. He pointed to the language in the 3M release, which essentially suggests that 3M is pushing back somewhat. We should also point out that that release says that 3M is being required to prioritize American needs. To what point that has to be done to the absolute exclusion of other countries is the crucial question, I think, in all of this. And you point out that they have been negotiating with the Americans for some time, even recently over the course of this pandemic. We see that tweet from Doug Ford. We know that just in the last few days, as I was following up on that story about the potential for troops at the border, that Chrystia Freeland was having conversations with American leaders, Bill Blair, Harjit Sajjan. We can be, I think, quite certain that those conversations are ongoing. In fact, I believe the Prime Minister referenced it, saying that these discussions have been going on for a few days now. The question is, of course, that the outcome.
And my colleague Aaron Wary reminds me that the 3M statement itself was fairly explicit in what the Prime Minister, for all sorts of political reasons, couldn't say, and that is 3M saying that if they were to do this, it would cause other countries to retaliate. So 3M being able to say things maybe more clearly than our Prime Minister, who's doing this delicate dance here. I'll just go back to the issue of modeling, because we are going to get to that shortly with a doctor and with Ontario. They have posted more information just, I think, yesterday, end of day. I try to look every day, but it seems yesterday there's been an update to the federal government's reporting on data, which is, fairly comprehensive, but still, I guess there's a desire to get more. And the Prime Minister again saying today that they are committed to doing that, Vashi.
Yeah, the difference, I guess, from between the data that we have available to us now and what the ask is basically we have the raw data, lots of it. You're absolutely right. On the public health website, you can find out, for example, how many cases there are, how many hospitalizations. It's broken down by demographic. What we don't yet have is any kind of projection, with the caveat, of course, that those projections are not a crystal ball, as we've heard many doctors outline on these specials, but rather a sort of gauge for Canadians who are extremely anxious about the potential for how long, or basically wondering how long this is going to go on. There's no way to know for certain. It's going to be impacted by our behaviors all the time, but there are a range of scenarios that various provincial governments are dealing with. That range we are expecting to hear about from the Premier of Ontario. Other premiers across the country have promised to release that data as well. Much of it has already been released in both Alberta and BC. And the ask of the federal government is to simply provide the same at a national level. Again, with another caveat, not just that it depends on our behaviors, but that they then have to assimilate and analyze all the data from the various provinces. Not all provinces, especially the smaller ones in the eastern part of the country, I would highlight New Brunswick, for example, have even enough cases to produce that data to analyze yet. They likely will towards the middle of next week, but at this point they don't. So again, the Prime Minister would not put a timeline on the release of that data. He echoed his comments from yesterday in expressing sort of an understanding, and it took a few days for him to express that understanding, that Canadians want that kind of analysis. They want to see the various models before the federal government, but more of the same in that promising it will come eventually, just no specific timeline attached to that. And he also said, I should say, that he has seen the numbers from Ontario. He has seen the data that we're to hear from Premier Ford a little bit later in about 40 minutes, but that he didn't want to preempt the Premier and release that data yet.
Yeah, I would encourage people to go check out, like, we're not all scientists, obviously, but there's a fairly good graph there on the federal website, the public health website, which gives you a sort of the way Canada is comparing to other countries. What no one has done is essentially what the president of the U.S. did, which was, if we don't do this, this many people will die. If we do this, this many people will die. No one has done that in this country. It sounds like Ontario might do some of that today, just based on some of what Mike Crawley has been reporting. I just want to get to a doctor before I let both of you, well, I'm not going to let you go. You're going to have to stay here, Vashti and Catherine. Thank you. But let's put some of these questions to Dr. Russ Upshur, who is hopefully going to help us understand a little bit more as we try to take on things that are difficult for people who aren't scientists, doctor. So what I guess we are expecting from Ontario is some sort of projection of how bad things could get. And that could include hospitalizations, ICU, and potentially deaths. Is that what your understanding is from what we might expect?
Yeah, I'm not entirely sure what to expect because I haven't seen the models or the results of the data either. But meanwhile, good afternoon, and it's nice to hear your voice, and I hope you're well and safe.
I am, and I appreciate that, and the same for you. So what are the limitations of these kinds of projections and modeling? I point to the example in the United States, which was sort of done for, I think, largely political reasons, to be frank. But what are the advantages or disadvantages in this kind of information?
So I liked what you said earlier, that many of us are not scientists. So this is an opportunity while we are on lockdown to increase our understanding of science. There are some really good resources out there that you can access. So the big question is, what is a model? And models are mathematical representations that are used to actually help us gain understanding of the complex world that we live in. So there's a famous statistician who said that all models are wrong or all models lie, but some lie more usefully than others. So models are critically dependent upon the data that we have in order to make them work. And some models are purely explanatory. They just describe things. Some things are projections, so they're forecasting. And we all know about forecasting models because we watch the weather and we follow the economy. So what we're going to find is that models give us a range of possible scenarios of what may or may not happen in the near future. But two things to remember. Models are only as good as the data that informs us. And if we're not happy with the data that we have, we need to ask ourselves questions about why we haven't supported public health in the way that we need to and fund it so that we have surveillance systems and systems of data that are actually able to be integrated and analyzed in a timely fashion. We can come back to that later. So secondly is that the models will sort of give us some near-term projections, perhaps. They may tell us some things that have happened already, but we're always working with what is called lagged data. In other words, what we're seeing in the data today reflects what happened a couple of weeks ago, which means we have to be extremely cautious about their interpretation. We need to be mindful of their limitations, and we most importantly need not get fixated on a particular time or date or number, because all models are equally provisional. That is, they hold for as long as the assumptions in the data support their veracity, and they need to be rapidly updated in terms of new information that comes in. So we're learning a lot from what's happening in other jurisdictions. That information, the really important thing is there's been a huge amount of information sharing globally, and clinicians and public health physicians are learning from the experiences of their colleagues in Italy, New York, and China. So everybody is desperately and quickly as possible trying to get their hands around and their minds around this evolving and difficult situation.
Yeah. So that's a super great explanation. Thank you for that. What is the benefit to the public of seeing not just models but projections? Because I don't think we have seen strict projections on things like the mortality rate. We've seen what it's at now, but in terms of if we continue down this road, this will happen. What would be the benefit to the public in knowing that?
So there's certain things that are attendant or flow directly from seeing projections. One is that we have very few medical countermeasures at our disposal right now. So our best weapon, so to speak, though I don't like to use that language, our best response to the challenges posed by the coronavirus is to do exactly what the Prime Minister was saying before he concluded his briefing. We need to stay resolved for social distancing, for physical distancing, for the measures that are in place. And I know it's imposing sacrifices on absolutely everyone. But until we have better ideas of how much is going on in the community, and we have better ideas from the people who are understanding the impact through perhaps the use of serological tests and other measures, we're going to have to use what we have at our disposal, which is ourselves. We're all reliant upon each other and and our own behavior to bring this under control.
I only have about a minute, Doctor. I wish I had more time because you're teaching me a lot here. But you did work in public health during the SARS outbreak. How important was the data, the modeling, and even the projections in shaping the response at that time? And I know we've learned a lot of lessons since then.
So SARS taught us, you might recall that those of us who were working in the public health side of things, doing the epidemiology, were trying to work with sticky notes. So the first lesson from SARS was that we needed to invest in a public health infrastructure to have data systems that provide us with real-time information so we can make good decisions, and that's still true today.
Okay, Doctor, I got to leave it there. I do appreciate it. I hope you'll come back because we're going to be talking about this more in the days ahead. Dr. Russ Upshur with the University of Toronto's Dalla-Lana School of Public Health. Thanks, Doctor. All right, we are standing by to bring you that update from Ontario at 12:30 Eastern, but we will also bring you on CBC News Network and CBC.ca the latest from the federal cabinet ministers and federal public health officials. I'm Rosemary Barton. Hello, I'm Rosemary Barton here in Ottawa. Welcome once again, wherever you might be joining us now on CBC News Network, but also streaming on cbcnews.ca and on our app. We heard from the Prime Minister just moments ago, who told us that he is working with the provinces now to release the most up-to-date and most accurate information on data in the analysis of data on COVID-19. We are expecting, though, today from Ontario to release some new numbers, some new projections, if you will, just this hour. They are projections that the Premier, Doug Ford, says are stark, and there is hope from the Premier and public health officials in this province that they could serve as a bit of a wake-up call about the spread of COVID-19, given that it will get into hospitalizations and potential fatalities, or fatalities that have been prevented because of some of the measures that have been put in place over the past number of weeks. The Prime Minister also made an announcement around food banks today, $100 million going to try and shore up food banks to protect food security for some of Canada's most vulnerable in this country, whether it be in urban areas or more remote or Indigenous communities. The Prime Minister, though, was also asked about a developing story around 3M and reports that the United States is trying to restrict where that company can send masks and equipment. Justin Trudeau says that would be a mistake.
We've been working very closely with the Americans to highlight what Canadians know very, very well, that the level of integration between our economies goes both ways across the border, that we are receiving essential supplies from the United States, but the United States also receives essential supplies and products and indeed healthcare professionals from Canada every single day. I think of the thousands of nurses, for example, who cross the bridge in Windsor to work in the Detroit medical system every single day. These are things that Americans rely on, and it would be a mistake to create blockages or reduce the amount of back and forth trade of essential goods and services, including medical goods, across our border. That is the point we're making very clearly to the American administration right now.
Okay, as we wait for federal cabinet ministers and public health officials federally to come in and give a briefing, as we wait for Ontario to begin its briefing at 12:30 Eastern, let's go back to my colleagues, Vashi Kapellis and Catherine Cullen, who, in the midst of these extraordinary times, extraordinary measures being taken on all sorts of fronts, and yet the sort of the same challenging relationship with the United States. Now, it does seem we've been able to walk them back through this pandemic or get them to where Canada wants them to be. But here we are in this situation again, Vashi, at a time when you hope the world is working in a more cooperative and collaborative way. Obviously, that's not always the case.
No, it's not always the case. And I think it feels at least like deja vu, as you were pointing out a few minutes ago. About exactly a week ago, the three of us were sitting here talking about the threat at that point that the United States had to militarize the border between Canada and the United States. It's, of course, the longest demilitarized border in the world. And that was sort of another issue that they had to deal with, that the federal government had to deal with in the middle of sort of trying to respond to the domestic crisis that was unfolding. They had had to deal with the possibility of the border being armed. Fast forward a week, and now the President of the United States wants to use sort of a wartime legislative ability to conjure up or direct industrial capacity to supply American needs. And in this case, those needs are shared by Canadian first responders as well as healthcare professionals. Those N95 masks, so central to their ability to be able to not themselves get infected when they are treating all the Canadians and Americans south of the border who have been afflicted by this virus. And the idea is behind the legislative measure that the president is trying to use, as I said, is to direct all that production to the United States. 3M, the maker of those masks, has come out saying, well, it won't exactly work that way. There are humanitarian concerns if we cut off the supply to Canada and Latin American countries. What we are not clear on is how much of Canada's supply would be impacted, first of all, of those N95 masks. How dire could it become? And also, how will this actually play out? Does 3M have the ability to fight back against that legislative leverage that the president is trying to use? I'm unclear on the answer to that. The Prime Minister was asked multiple times about this, and he very much continued to point out, which actually, it's funny because we were talking about deja vu, the same sort of thing that we've heard at each of these junctures over the past 3 years, right? Every time the United States sort of throws a curveball, we keep hearing similar lines from the federal government, and that is an emphasis on the interdependence of both of our countries. The economy, one point of obviously overlap, but also in this case, essential workers. There are 1,000 nurses in Windsor who work in Detroit, and the Prime Minister highlighted that, sort of tried to underline, I guess. He said Americans depend on them. It would be a mistake for our countries to limit access to goods and essential personnel. That's what we're pointing out to the U.S. administration. Sometimes the stuff the federal government points out works, and like last week, the U.S. government backs off. It's unclear at this point whether that will be the outcome in this incident.
Yeah, it's really, I mean, it's always challenging to read the president, who is under, obviously, an intense amount of political pressure himself during an election year, trying to manage this and convince Americans maybe that it isn't as bad as it appears it is. And if he's having to sort of pull out all the stops to try to protect his own citizens, it's very challenging to see how we respond to that kind of thing, Catherine.
And I would make a real distinction between what happened last week and what's happening right now. Now, obviously, we have to look at this relationship with the U.S. over the course of Donald Trump's presidency, and there have been many instances. But if we're just looking at what happened in the last week when Donald Trump was actually asked about this request, this suggestion that 1,000 soldiers might be brought to the Canada-U.S. border, he seemed to be caught publicly completely unaware. In fact, he suggested that there were already troops at the border, which is not the case. Of course, as Vashti rightly said, it's the longest undefended border in the world. So there was a sense, at least from what we saw publicly, that he didn't necessarily have a stake in that particular issue. We saw actually a document that was put forward by a U.S. magazine suggesting this was something that Homeland Security, Border Services was interested in, not something that Donald Trump was personally invested in. We don't know the specifics of this. As the audience is hearing, we have a lot of questions right now about how all of this is going to work. But if this is something that Donald Trump believes is in the United States' best interest, then I would say it becomes that much more complicated, perhaps, in trying to sway him to Canada's point of view. And I think we got a bit of a sense of how that might work from the Prime Minister today. I'd be very interested to hear from Chrystia Freeland on this as well, Deputy Prime Minister, and obviously an important point person in the NAFTA negotiations. We can see that Doug Ford has already been enlisted or decided to act. I suppose we don't know, but in any case, that he has been speaking with Robert Lighthizer, reaching out, trying to persuade the Americans. We can imagine that this will be something of a full court press.
Yeah, and it is this sort of tendency towards nationalism, for lack of a better word, in some ways makes sense. I mean, from our perspective, we are trying to create domestic supply lines. We are switching industries over from, one thing to producing medical equipment. What is different in this case is the restrictions the United States is trying to place on a private company to do its business outside of the country at a time when that would be a critical supply chain, Vashti. But you can kind of see why countries are moving into this direction. And you heard Doug Ford was saying it the other day too. He plans to do everything he can so that we don't run into this again. So we are, as Catherine's been talking about, out in the world, trying to bargain for pieces of equipment.
Very much so. And we've heard that repeatedly from the Prime Minister over the past few days, from Minister Navdeep Bains. The whole idea behind all of their efforts to retool industry in this country is to make it so that we are not as dependent on supply from and manufacturing from other countries. The difference is they haven't said, well, we're going to cut off, sending things to other places. However, if we step back from our own interests and Canada's interests, it does make sense on the surface, at least the messaging around sort of the protectionist message that the president is espousing right now. It makes sense right now, but it also worked for him politically in the past. This sort of America First message is one that resonated, particularly in parts of the country that we know very well, in the Midwest, for example. And the message right now, I think that if people in the United States are concerned about their healthcare professionals or themselves being able to access the supplies and equipment they need, I don't think he's going to get a huge fight from within the country's borders. Obviously, as I said, the distinction is, we're saying the same thing, shore up domestic supply. We aren't saying cut off the supply to other countries or other people, especially next door, who might need them.
Yeah, and in fact, we heard out of that call yesterday between the Prime Minister and premiers that premiers all have agreed that if something happens, there's a surge in one part of the country and they need supplies, then everybody will sort of come together and make that happen. I realize that's inside our own borders, but that sort of collaboration you would hope to see in other places as well. I mean, it is part of the reason why Canada sent a vast amount of equipment to China in the early days in a bid to try and contain a global pandemic, but also knowing that everyone was going to be dealing with it at some point or another. I should point out on the equipment, though, that we did get that update yesterday that really millions of masks have arrived this week. There was 10 million that arrived earlier in the week, 1 million arrived in Hamilton. There were donations of some masks that have been now verified and will be sent out to the places where they are needed. But we've talked a lot about in our own news meetings, and I'll go to you, Catherine, on this, what hospital officials call the burn rate. And that is the idea that they are going through equipment a lot faster than they have before. Okay, I'm not going to let you talk, though. I'm sorry. the ministers are arriving, so you can start when we are done. A reminder, we are going to take part of this federal press conference, and when the Ontario briefing begins at around 12:30 Eastern, we'll go to that live because our colleague Mike Crawley already has done some reporting that the measures in place have prevented many more cases of COVID and deaths, but that will have to continue in a stricter way. Here is the Deputy Prime Minister of Canada.
Thank you for being with us today.
Canadians must continue to practice physical distancing. We all need to stay strong and stay at home. I'd like to say something this morning to our elders, our aunts and uncles, our mothers and fathers, our grandparents. I've been thinking about you a lot. You raised us. You built our amazing country. Now you are staying inside and you are physically separated from your loved ones. I know that this is really hard. And I want you to know that we love you very much. And we are doing everything in our power to keep you safe. When my children find the physical distancing hard, I remind them that they are doing it for themselves, for the whole country, and also for the elders in our family they love very much.
Canadians must continue to practice physical distancing, stay strong, and stay home. I now, this morning, want to talk to our elders and our seniors, our aunts and uncles, our mothers and fathers, our grandparents. You have raised us. You built our wonderful country. Now, you are inside and physically separated from your loved ones. This is very difficult. We want you to know that we love you. We are doing and will continue to do everything in our power to protect you.
So today we will hear from our Minister of Health, Patty Hajdu. Then we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam. We will hear via video conference after that from notre ministre de l'Agriculture et l'Agroalimentaire,
our Agriculture and Agri-Food Minister,
et après ça, du président du Conseil du Trésor,
the President of Treasury Board,
and we also have with us to answer your questions, Dr. Howard New. Patty, please.
Thank you, Deputy Prime Minister, and good morning to everyone. Let me first start by sending our deepest condolences to the families of those who have lost their loved ones to COVID-19. Our hearts are with you during this incredibly difficult time. We continue to work together at all levels of government to defeat this virus, and in this war, I'd like to remind everyone that we're on the same side. I'm confident there is an end to this, and we will come out stronger together. So in that note, please don't forget to download the Canada COVID-19 app. We've had 123,000 downloads over the last 2 days. This is a very useful tool. It will give you constantly updated and accurate information about Canada's fight against COVID-19. It provides accurate, detailed data about what is happening across the country. And it will also provide you the ability to check your symptoms if you feel that you are unwell or unsure. And with that, I'll turn to Dr. Tam. Thank you.
Hello, bonjour, everyone. So I'll start with the update on our cases in Canada. There are now 11,747 cases of COVID-19, including 152 deaths. Again, this represents infections from previous exposures and not what is happening right now. So again, our urge is that even if you're not hearing about cases in your community, it doesn't mean that there is no risk of exposure, and we must all consider that anyone could be infected and keep our 2-meter distance as the safest approach. We continue to test at a high rate in Canada, with tests completed for over 290,000 people in Canada. Around 4% of these people have been confirmed as positives and 95% confirmed as negative. Maintaining our testing around this 3 to 4% positivity will keep us within a good range to try and accurately detect where the disease is circulating. We are, however, continuing to increase our laboratory capacity to make sure that we maintain this kind of level of sensitivity in tracking COVID-19 activity across Canada. This is a frustrating time as we continue with strict public health measures while waiting for signs of improvement. So far, thanks to all the efforts of Canadians, the health system in Canada is coping, and we need to keep it this way. There are areas where the virus has been the most active, like Vancouver, Toronto, and Montreal, but these areas are managing too. Comme vous le savez, le COVID-19
As you are aware, COVID-19 can cause severe illness, but the disease course can take several weeks to progress. Hence, severe outcomes, including deaths, will not be occurring in high numbers in the early weeks. But as the outbreak progresses, fatalities will begin to accrue. This could explain why we are seeing a sharp rise in deaths reported in recent days. This is a sad reminder to us all that we must take this disease seriously. We can draw hope from the fact that countries particularly hard hit, like Italy, are now showing signs that the epidemic may have peaked.
As you're aware, COVID-19 can cause severe illness, but the disease course can take several weeks to progress. Hence, severe outcomes, including deaths, will not be occurring in high numbers in the early weeks of this epidemic, but as the outbreak progresses, fatalities will begin to accrue. This could explain why we are seeing a sharper rise in deaths reported in recent days. This is a sad reminder to us all that we must take this disease seriously. We can draw hope from the fact that countries particularly hard hit like Italy are now showing signs that the epidemic may have peaked. We're here to learn about the lessons learned and the perspective of all of these countries as we adapt our responses. Our knowledge, our science undergoes evolution over time. This is a pandemic that has not been with us for very long. And public health colleagues, experts across the country are now continuing to learn and adapt our knowledge as these become available in real time. So, of course, we owe it to everyone to not put another Canadian at risk and to do all we can to stop the spread of COVID-19 right now. Thank you.
Okay, thank you, Dr. Tam. Et maintenant, je donne la parole à la
And now I'll give the floor to the Minister of Agriculture, Marie-Claude Bibeau. Please go ahead. Thank you, Christian. As Minister of Agriculture and Agri-Food, my main concern at this moment is to ensure that everyone has access to a variety of healthy and nutritious food. Because of COVID-19, food banks and other community organizations can no longer meet the demand. They have lost many volunteers, often seniors. They have to reorganize their facilities to minimize interpersonal contact. Some clients are more isolated, and now they have to provide home delivery. There are fewer donations in food and in money. There are multiple challenges. That's why today, Prime Minister Justin Trudeau announced $100 million to support food banks and local organizations on the front lines. There are 5 large food delivery networks that can meet the needs of the various clients across the country. Food Banks Canada will receive $50 million, while Second Harvest, Community Food Centres Canada, Breakfast Club, and the Salvation Army will share the $20 million. Each food bank from each region in Canada should be able to very quickly connect, directly or indirectly, to one of these 5 main networks. For example, in Quebec, the Moisson network is a member of the Food Banks Canada. The rest of the $30 million will be provided later, where we will have identified gaps.
Access healthy food is something we all care about. COVID-19 is increasing the number of Canadians who struggle to access food and is having a major impact on the operations of local food organizations. Food banks of all kinds are being forced to adapt, to find younger volunteers, to minimize interpersonal contact, to offer home delivery. The challenges are great. Today, Prime Minister Trudeau announced $100 million in support of organizations who are on the front lines, making sure people get essential food support in their time of need. Food Banks Canada will receive $50 million, while $20 million has been evenly divided between Second Harvest, Community Food Centres Canada, the Breakfast Club of Canada, and the Salvation Army. These organizations will work with local partners to meet urgent and increased food needs, including those in Indigenous and Northern populations. The last $30 million will be allocated later to fill the gaps and respond to further needs. I invite all my MP colleagues across the country to reach out to their local food banks to make sure they are connected to one of the 5 partners. I want to take this opportunity to also announce that through the Food Policy for Canada, through the Local Food Infrastructure Fund, as of today, 362 projects across the nation have received funding for a total of $6.6 million. Dans le cadre du Fonds pour les infrastructures alimentaires locales,
as part of the Local Food Infrastructure Fund, which is part of the Food Policy for Canada, I'm pleased to announce that 360 projects have so far received funding for a total of $6.6 million.
Working in all parts of our food supply chain are stepping up during this extraordinary time. And I invite those who can to please consider supporting your local food bank or community organization. Farmers, folks working in food processing plants, truckers, clerks in grocery stores, and obviously volunteers in food banks are all proud members of a critical infrastructure, the food supply chain. If you're healthy and available, consider joining them. J'en profite pour remercier les travailleurs.
I would like to thank our essential workers who have been showing up on our farms, our food processing plants, on our roads, in grocery stores, at food banks throughout the country. Yesterday, the list of essential services was made public, and it comes as no surprise that the entire food supply chain was on that list. Take care of yourselves, take care of your people, your families, and if you're healthy and available, think about providing your services to the food sector. Thank you.
Merci, Marie-Claude.
Thank you, Marie-Claude. And now I'll give the floor to the President of Treasury Board, Jean Duclos. Please go ahead.
Everyone, et bonjour tout le monde. Aujourd'hui, le message du Premier ministre.
Today, the Prime Minister's message is one of helping each other out. The first important one is the one that Marie-Claude just told us about, the $100 million for food banks across the country, and in particular, the Salvation Army, Moisson Québec, and other particularly active organizations in Quebec. The second message is the GST tax credit being provided sooner in April. That's on average $400 for one-person families and $600 more for two people, families of two people or more. It's also a message of helping others out through the involvement of the Rangers for the Canadian Armed Forces in the northern and remote regions of Quebec. We know that they will play an important role to help protect these communities that are often very vulnerable. This is a message of standing together so that we can keep hope, keep taking care of each other to get through this crisis.
Okay, merci Jean-Yves.
Thank you, Jean-Yves. And now we are ready to take your questions.
3 questions on the phone, 1 question, 1 follow-up. Operator?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, notre première question is from Mélanie Marquis avec La Presse. Please go ahead. À vous la parole.
Merci. Bonjour. Ma question est pour
Hello,
Madame
thank you. My question is for you, Ms. Freeland. If you could give us a summary of your talks with the Americans yesterday regarding the medical supplies that were turned away from Canada, and what do you think of the Trump administration's decision to demand that 3M stop exporting masks to Canada? What could the implications be? All right, thank you for your question. This is a very important question on a very important issue for Canada. Our government is very engaged in this issue. This morning, one of our ministers had a very good conversation with the head of 3M in Canada. I want to thank the company for what it stated publicly regarding their position. Now, with regards to the U.S., our government has begun very strongly explaining Canada's position regarding this issue. It's teamwork for Team Canada. I was speaking with Ambassador Hillman just 20 minutes ago before this press conference. We understand how important this issue is, and all the ministers, the Prime Minister, myself, our embassy in the U.S., even the premiers of the provinces are committed and engaged. We are trying to fix this issue. We have already started speaking with our neighbors and partners and military allies in the U.S. regarding the longer term, our cooperation in our fight against this virus. It's really an important issue. The government is completely engaged in solving this issue, and we will continue to work on that.
Sure. Est-ce que je peux répondre en anglais? Je m'excuse.
May I respond in English? Sorry.
So thank you for the question. This is indeed a very important issue, and our government is very energetically working on it. Minister Anita Anand, our Minister of Procurement, had a good conversation earlier today with the CEO of 3M Canada. And I would like to draw everyone's attention to the company's very helpful statement issued earlier today. We are, of course, working very energetically, directly with our U.S. counterparts. I really want to emphasize to people this is a whole of government effort. All ministers are going to be and are reaching out to their U.S. counterparts. The Prime Minister is very personally involved, as am I. Just 20 minutes ago, I spoke to Ambassador Hillman about the plan that we have put together to really press very hard on this. And we're also getting some of the premiers involved too. So a very important issue. We're going to just pull out all the stops on this one.
Juste pour aller dans le même sens, Madame Freeland.
Now, in the same vein, Ms. Freeland, from the beginning of the crisis, we know that the U.S. has had problems managing the crisis. There were threats to deploy the army, and now they're asking that medical equipment not be exported. I mean, what kind of neighbor is the U.S. turning out to be at this time, in your opinion? The U.S. is our only neighbor, really. This relationship is a very important one for Canada, as all Canadians understand. It's very important in terms of the economy, in terms of the social aspects of our lives, and also militarily. As Canadians understood, it's a relationship that is very important in terms of health. For each Canadian and every Canadian government working with the U.S. and finding a way to represent and defend the national interest of Canada in our relationship is a priority. It remains a priority, and it is for our government. I cannot tell you that it's always an easy job, but I can tell you that it's a priority for us, and I can also tell you that every minister, starting with the Prime Minister, has a good relationship with their U.S. counterpart. I could perhaps add just one more thing. The coronavirus is a global pandemic. It is not surprising that faced with a worldwide pandemic, all countries are finding themselves in a crisis, in an emergency situation. During a global crisis, it's normal to find this kind of issue cropping up between countries. I can assure you that Canada will continue to defend its interests, and as we did to solve the issue of military personnel at the border. All Canadians understand that the relationship between Canada and the United States is an essential relationship for our country. This is a relationship that is extremely important for the Canadian economy. It's a relationship that is extremely important when it comes to Canada's security in the world. And I think we are now understanding it's a relationship that is very important when it comes to meeting our healthcare needs. In times of crisis, like this global pandemic, all relationships at every level can face challenges. And this is no exception. Having said that, we have been working extremely effectively
with the United States throughout this pandemic. The reciprocal and collaborative way in which we introduced restrictions on travel between our two countries is a very good example of that. So is the way that we have worked to resolve the possibility of U.S. troops at our border, which Canada strongly opposed. We're going to continue to face challenges throughout this crisis in every relationship that Canada has. We're going to work hard to resolve them. And I do want to assure Canadians that this is a huge priority for our government. And the good news is that every minister in our government, starting with the Prime Minister, has a very effective working relationship with his or her U.S. counterpart. We have a great ambassador in the United States. And we're going to be working hard on this.
Okay, we're going to pull away from this federal briefing. Many questions about the 3M masks and our relationship with the United States to bring you now to Ontario. Ontario is expected to give us a better sense of the numbers, what they look like now, and what they could look like in the future. So we'll bring that to you live and talk on the other side.
From the Dalla Lana School of Public Health at the University of Toronto. All right, I'll let them deliver their remarks now.
So good afternoon, ladies and gentlemen. We'll deliver some opening remarks and then we'll be happy to take your questions. The information in our presentation today was developed by several experts in Ontario Health, Public Health Ontario, and researchers at Ontario universities. All of this led by the COVID-19 command table. Our objective today is to share the modeling and projection data that Command Table has been using to inform our work and has been using to advise government on their response to COVID-19. We feel it's important to be transparent with the public about the scale of the challenges which together we are facing, and the important work that we all need to do to help flatten the curve. How this outbreak unfolds is in the hands of the public, in effect, in all of our hands. We can change the outcome for the province by staying at home and physically distancing ourselves from each other. Now, recognizing that we get new information about this virus and this outbreak on a daily basis, we will, of course, continue to refine our projections, our models, and our advice. Everybody should take reassurance from the fact that our public health measures so far have made a significant difference, and we need everyone to stay focused in the weeks ahead. So stay home, stop the spread, and stay safe. For media following along with the slides, I'm now turning to slide 4. There have been 67 deaths in Ontario. I appreciate that some people may see different figures from that, but those are the figures that have been processed through the integrated public health information system. And although I can fully understand that it may appear confusing or even frustrating for some members of the press when they hear about deaths reported in the media locally, it must be frustrating when the deaths count does not quite tally. But it is important that you understand that the correct way to track this over time is through the Integrated Public Health Information System, IFIS. There will just be a little lag as hard-pressed public health units insert the necessary details. The thing that is striking from the data that we thus far have in Ontario is the high mortality rate in those over the age of 80. Thus far, it is 16%. That is actually a little less than global experience, where the evidence from around the world suggests that the mortality in those over the age of 80 is actually 20%. The mortality in those over the age of 70 globally is also significant at around 10%. These are very important figures for us all to be familiar with, because it tells us that we must focus on protecting the elderly. On the next slide, for the media who are following along, you will see COVID cases in Ontario tracked against those in other countries and other jurisdictions. The thing that I must draw your attention to is the fact that there is a logarithmic scale along the left-hand side of this graph. And of course, what that means is that a small increase in the graph equates with a very large number of increases in cases. Nevertheless, in an epidemic situation, this is usually the most useful way to track the progress of a disease. And as you can see from this curve, we are following a trajectory somewhat similar to that in the United States, not quite as good currently as that in British Columbia. But I would hasten to say that when one tracks cases, it really is rather difficult to know exactly where you stand. You have to watch it extremely carefully because it is rather dependent upon who you test for the disease. If I turn to the next slide, we are tracking deaths. Now, sadly, deaths around the world are mounting. And one of the things about tracking deaths as opposed to tracking cases, they are not subject to the same complications that are brought about by differences in testing strategies. And so here again, you can see that we appear in Ontario to be roughly in line with the rest of Canada and to be roughly in line with the United States. But of course, once again, we will continue to watch this extremely carefully. It is important to acknowledge at this point that a great deal has already been done in this province that will help limit the eventual death toll from COVID. So if, for example, we go back as far as March the 12th, we had the closure of public schools. Rapidly after, there have been a series of other measures. For example, limiting visitations to long-term care, looking carefully at those who are in short-term in and out arrangements with correctional facilities, and prohibiting large gatherings of over 250. By March the 16th, people were being told to practice social distancing. Travellers from outside Canada were being told to self-isolate for 14 days. The prohibition on gatherings was dropped to 50. And people were told to work virtually wherever possible. By March the 17th, we had the closure of public gathering places and establishment. By March the 21st, redeployment for healthcare professionals. And then rapidly in succession on the 23rd, 24th, and 25th of March, the closure of non-essential workplaces, work deployment for LTC homes, and the prohibition of gatherings of more than groups of 5 people. Most recently, we have seen enhanced capacity for contact tracing being rapidly put in place. We have seen the closure of parks and outdoor recreational facilities, and people have been instructed to limit outings to essential needs. Self-isolation for individuals over 70 and those who have underlying medical conditions or who are immunocompromised has been very strongly recommended. We also have had extended school closures. I'm now going to pass across to Steny Brown.
Thank you. I want to just start on slide 9 for those who are following on with slides and talk a little bit about some of the caution with which any models need to be interpreted. They're really used to help us plan what could happen. But, I say this with very great seriousness, they are always an abstraction of what we're dealing with, and the farther out we go, the more uncertainty there is. We've used assumptions based on what we've seen in other outbreaks of COVID-19 and what we can gather from data around Canada as well to try to inform the model. And then we model how it spreads, and we do this based on standard epidemiological models where we can. And we try to make assumptions about how quickly, or make estimates of how quickly and how widely the disease will spread. Critical to say that we'll talk about what would have happened had we done nothing. We'll talk about what may happen now, given the public health interventions that are in place. And we'll also talk about what could happen if we had enhanced measures to continue this or to try to suppress the disease as far as we can. It's important to note, though, these measures only work if people follow them. And so the assumptions that are in place here are assumptions about people working to make sure that they stay safe and keep the people around them safe. And it's important to note well that if there are people with COVID-19 infections moving between healthcare facilities or other places where there's many people living at the same time, there could be larger outbreaks. Going along to the next slide, which is slide 10, you'll see the curves that look at the different countries that Dr. Donnelly's already talked to. I just want to lay out that the Ontario curve is shorter because of a shorter period of experience with the disease. But that point way on the far point there of a significant number of deaths, almost 100,000 deaths, is an estimate of what we might be looking at within 30 days had we not taken the initial measures. And I talk about what this case would be like had we not taken measures, because I think it's important to convey the seriousness of the threat presented by COVID-19, and also the issue that were we to relax or to assume that we were in safe territory now, this is a disease that can rear back very quickly. But you can see here 100,000 cases within 30 days had we not done anything. If you go to slide 11, you'll see a little more clear representation of this. The 300,000 cases with a lot of growth right there. The current intervention, what we mean there in the middle is that there is a substantial reduction given our public health interventions in place, but perhaps still about 80,000 cases that we might see if the disease continues to grow as it does in other jurisdictions. But looking at cases here, 12,500 roughly cases we'd expect by the end of the month if we take new enhanced measures to suppress the disease. If you go on to slide 12, you'll see a similar presentation of deaths here. Had we taken no action, again, even within the short 30-day period between here and now, you'd be looking at up to 6,000 deaths. Thankfully, there have been some actions taken, and this leads us to a current estimate of about 1,600 deaths, so a substantial reduction in the number of deaths over the month of April. But were we to put in significant, actually I misspoke, 1,600 deaths that would have occurred from cases that developed during the month of April. But were we to take strong action now, the number of deaths that we'd be looking at from cases that developed during the month of April would be much lower, at around 250 in the future intervention. With that, I'll turn it back over to Dr. Donnelly.
Steny, thank you. Ladies and gentlemen, as Steny has correctly pointed out, projections and modeling of a brand new viral disease are very inexact. But what is important is that we use them early and quickly to advise us as to the correct measures to take, and that is what has happened in Ontario. I want to turn now to perhaps what might be the most disturbing slide in this deck for those who have the deck to hand, and that is the slide which is on page 13. I think it's important that we all are robustly realistic about the scale of the challenge that we face. And what this slide shows is the projection by Public Health Ontario, which is in line with that of other highly credible modelers, that says that over the full course of this pandemic, which may last for 18 months or even 2 years, because we may have a smaller secondary or tertiary wave over the full 2-year course of the pandemic. Had we done nothing, Ontario may have suffered 100,000 deaths. Thankfully, that is not the position that we are in, because of the very detailed actions that I read out to you before, which have been taken in response to emerging science. We believe that if we do all that we can get a much better end result for the province. It is not possible to be exact about where we will end up. But I think it is reasonable to say that if we do everything that we can think of, everything that already has been done stays in place, all of the other measures which are being considered put in place, that I think we could reduce the death toll in Ontario to somewhere between 3,000 and 15,000. There is a range because where we end up depends on all of us. If we follow the rules, if we do our best to socially distance, if we look after the elderly and the vulnerable in our society, we can get within that range and we can strive to get as low as possible within that range. So I appreciate that to many people, these will be shocking figures. But the important thing to stress again is that effective actions have been put in place, remain in place, and further actions are being proposed and are being taken. Now, we need to turn at this point to the important issue of all of the preparedness work which has been going on within Ontario Health Services. So I'm going to turn to Matt Anderson from Ontario Health.
Thank you, Dr. Donnelly. Good afternoon, everyone. For those who are following with the slides, I have one slide, and this is the slide on ICU capacity in Ontario. We use this slide as I think we all know, there are many different components to our health system. It is a very big system. This is a bellwether measure for us as we think about how do we get a sense of our preparedness and our readiness for this pandemic within our healthcare system. So the ICU capacity is a good measure for us. If you don't have the slide, what this describes is two curves, much like you saw from Dr. Donnelly and Dr. Brown. This is a slightly different data set because we update this every day, so tomorrow's numbers will be different than today's. But we do look at, do we have the capacity in our system to be able to support the people who are going to need our wonderful healthcare system? Right now, and what you would see if you have the slide, is there's two lines on there. One is the amount of capacity we have in our system today. The other is the amount of capacity that we can surge to today. We continue to try to move that second line up. We want to get as much capacity in our healthcare system as we can develop in the very short time periods that we're discussing. There are two bar charts, however, on this slide that are most telling. The first one, which is in blue, shows that is our best case scenario given the data that we have at the moment, given the projections that you've just heard from Dr. Donnelly and Dr. Brown. And what's core about that is that that line brushes right up against what we are able to expand our healthcare system to today, at least as it relates to critical care capacity. The other bar chart is what happens if we do not adhere to our social distancing. And if we start down the paths that you've heard described between Dr. Donnelly and Dr. Brown of not containing this disease and this disease growing more rapidly, and what you can see from the slides is fairly soon, in the April to sort of early May timeframe, it'll push beyond the capacity that we can bring. I would say that both on ICU capacity and on the entire system, your healthcare system, all of our wonderful people who work in it, we are trying everything we can to continue to increase the capacity that we have to respond to this disease. However, as you've already heard, we need everyone to play their part. We have to try to keep the prevalence of this disease to a minimum to allow our healthcare system to be able to support those who need it. Thank you.
Matt, thank you. Just two more slides from me, and then we'll pause and take your questions. So people ask how one slows the spread. And I need to introduce you to what sounds like a complicated concept, but really is not. It's the so-called reproductive number, or the effective reproductive number of this virus. And it's actually a lot simpler than it sounds, but it's worth thinking about, because I think it helps us all understand what we should do. So if I was sitting here with COVID and I managed to give it to my two colleagues, that would mean that I had contributed to a reproductive number of 2. And if they then gave it to two colleagues again, you can very quickly see how the disease continues to grow at pace. If, on the other hand, my two colleagues both had COVID, but through proper social distancing and proper hand hygiene, etc., they managed, one of them to give it nobody and one just to give to me, you can see that the reproductive number then is less than 1, it's 0.5. And of course, what happens then is that the disease begins to peter out. So it's about breaking the chain of infection. And it's very important that every one of us realize that we have a personal responsibility and a personal opportunity to do that. So we need people to stay home, to stay focused, to stop the spread, and to stay safe. Everybody needs to fully adhere to the public health measures that are put in place, because we want to avoid overwhelming the health service in the way that Matt has just described, and the way that tragically you will see reported on the news media from around the world. So bearing down heavily on this disease now saves lives, allows our health system to cope, and also helps the economy. And this is not widely recognized, but is important. There is convincing research that suggests that if you bear down hard at this point, it actually brings the disease to an end more quickly, and it allows the economy to bounce back. So there is no dilemma between saving lives and saving the economy. Bearing down hard now achieves both things. Finally, I need to run through a number of immediate focus, additional public health measures, and also future measures which are coming. So the first thing that is very much being worked on as we speak is enhanced capacity for case and contact tracing. In jurisdictions elsewhere in the world that have done particularly well, this has been very important. It's about breaking the chain by assertively chasing down cases and their contacts. There is a small army of federal employees, medical students and others being assembled to actually address this issue. They will be working closely with Public Health Ontario, with the Ministry of Health, with Ontario Health, but particularly with the public health units in the province. The second thing is increased testing due to very impressive efforts by frontline lab staff and lab leadership, not just at Public Health Ontario, but across the province in many of our hospitals. We have now eliminated the backlog of tests. That is important because that now allows us to use tests in a very focused and strategic way. For example, testing residents of long-term care homes and their carers needs to be a priority. As we have tragically seen, if you get even one case in a long-term care home, it is very easy for it to spread very quickly and to bring about many deaths. So we need to use our testing strategically to protect the elderly and the vulnerable. We need to use our testing strategically to protect healthcare workers, to protect our hospitals, to track symptomatic contacts of cases, and taken as a whole, we need to use testing as a subcomponent of our strategy to drive down the infection. Future measures include the further reduction in the number and types of essential workplaces. This has to be done carefully, and everybody understands this, I think. Those who would cry, simply shut everything down, need to remember that we need our nurses and doctors and healthcare workers to get to work. We need our laboratory workers to get to the labs, and we need transport to operate to get people there. The public need to be able to get groceries, pharmacy supplies, and other essentials of life. So reducing the number and types of essential workplaces is something that needs to be done carefully and thoughtfully. There will be an enhanced focus on enforcement and fines for non-compliance. Physical distancing guidelines will be further enhanced, particularly with regard to retail settings. It is essential that we provide enhanced support for the elderly, for the homeless, for vulnerable populations, and for communities. The concept of a ring of steel around long-term care homes is important. I applaud those jurisdictions who have proactively moved to house the homeless in accommodation which may prove life-saving. Many First Nations communities are looking very carefully about overcrowding in housing, and again, I welcome the approach that some public health units have taken in working with First Nations to reduce overcrowding and therefore to reduce vulnerability. Some First Nations are looking at entry restrictions to their territory. Human resource management is going to continue to be important. We have to protect our healthcare workers. We have to allow them to look after us. We are exploring rapidly use of technology to reinforce self-isolation, including, for example, alerts, and additional public education and communication will be forthcoming. Once again, in summary, and then I will stop for your questions to any of the three of us, we need to bear down heavily on this disease now because it will save lives, it will allow our healthcare system to cope, and ultimately it will be the best way to help our economy bounce back. I'm happy at that point to pause, and we will do our best to answer any questions you might have.
Okay, so just a reminder for everyone on the line, the Premier's press conference has been pushed back to 2 p.m. now, and we're going to take questions until 1:45. I'm just going to remind the speakers, before you answer a question, please just say your name. And now we're going to open the lines for the first caller.
Your first question comes from Mike Crawley with CBC News. Please go ahead.
Hi, my question is for Dr. Donnelly. Dr. Donnelly, I've heard from lots of different sources that the reason that these projections were not made earlier is because the data coming from Ontario has been incredibly slow, and because of all the delays in the testing and the delays in getting test results out there. How do you respond to Public Health Ontario's own responsibility in the shortcomings of Ontario's testing regime and the shortcomings of Ontario's transparency with this data?
Mike, it's not true that the projections in terms of mortality were at all delayed. The projections in terms of mortality are not dependent on testing data in the first instance. It is entirely possible, and this is what we did, to make projections in terms of mortality based on the global experience thus far of COVID. And so the presentation to the command of what at that time was our best estimate of worst case scenario mortality, which at that time was 91,000. I know you understand that this is not an exact science, but we predicted right back at the beginning of March that the mortality could be that high based on global experiences, and presenting to command in that way led to the immediate decision to bring about school closures. And beyond that, I have articulated all of the various measures that have been taken. These have all been taken in response to an assessment of where the province was. Public Health Ontario has the role in this situation of communicating science right into the heart of the decision-making process. It is important for everybody to understand that Public Health Ontario has done that fearlessly, will continue to do that fearlessly, and what's more, that is what our political leaders want. I have personally briefed the Premier and the Health Minister. They listened respectfully, they were very thoughtful, they are utterly committed to getting this right. I personally sit on both the command table and the executive command table, and so I have direct access on a day-to-day basis to the three co-chairs of that command table. Helen Angus, the Deputy Minister, Matt Anderson, who's sitting on my right, the head of Ontario Health, and Dr. David Williams, the Chief Medical Officer. So science has been to the fore in informing the response of the command table during this epidemic.
Okay, we'll just take a very brief follow-up.
Okay. I didn't hear an answer responding to the question about the delays in testing. And my understanding is that the data was not actually provided to the people doing the modeling, the epidemiologists doing the modeling, until late last night. So if you could please respond directly to those two specific things, the delays in testing and the delivery of the data that the epidemiologists needed to do all of this modeling.
Sure, happy to do so. The release of data is a thing that only the ministry can do. The ministry has decided to release data to anybody who wishes to model this disease. I think that's a very sensible thing. Modeling as you move through this epidemic will become increasingly complicated, and we will need to draw on the very best brains. And so I think it's very wise that all of the data is being made available. But once again, the early projections of mortality were made, were provided right into the heart of this process, and so they determined the policy response. Your second point about testing is also important. Public Health Ontario, as the regional reference lab, has ramped up its testing capacity considerably. But this is an unprecedented situation where we have required everyone to become involved. And there is now a very strong cross-provincial approach, which means that the testing capacity in the province is greatly enhanced. As I said, that means that the backlog has now been eliminated. It is true that there were challenges earlier on with testing related to a global shortage of some of the key reagents. That is something that needed to be overcome with Herculean efforts by many in the system. And I think it has been very heartening to see how all of the system has pulled together, has secured the necessary materials to do this testing, and it's great that we now have eliminated our backlog and that we can test in a strategic way.
Okay, we'll move on to the next question.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Dr. Donnelly, I'm wondering if you can walk us through the that range there of projections for deaths, 3,000 to 15,000, in a little bit more detail. Obviously, you acknowledge that this is a pretty wide range, but I think that's the number that most people are going to look at here, and probably be a bit concerned about, afraid about. How specifically can the province push that to the low end here of 3,000?
Yeah, a very good question and a very good challenge to us all. Let me give you a little bit of context, because I appreciate that people will feel that even a range of 3,000 to 15,000 may seem not just scary and intimidating, but to many people unlikely. And so I just need everyone at this point to pause and consider carefully the following: that every year in Ontario, we lose about 1,350 individuals to normal seasonal flu. So in a bad year, we may well lose 1,500 to normal seasonal flu. Now, when you think that the mortality of this disease is up to 10 times higher, and when you remember that we have no vaccine, we have no specific treatment, and this is a disease which is entirely new to the population, then suddenly the figure of 15,000 becomes entirely logical and comprehensible. Now, that being said, we have in place, as we've just discussed, a lot of social distancing measures. That, taken along with the other public health initiatives that I referred to, pushes back, if you like, in the other way. So the best answer I can give you in terms of how we get closer to 3,000 and 50,000 is that we need to bear down. We need to do all of the things that we're doing, and these additional things that I mentioned.
Follow up?
On the high end there, the 100,000 deaths that were possible, I gather that this means in absence of any measures whatsoever to address this issue.
That is correct, and thank you for pointing that out, because I do appreciate that people will find that figure understandably alarming. So let me use your question just to state again very clearly that that is not where we are. That is not what we believe is going to happen. But that is why we needed to do all the things that we have done thus far, and it's why we need to continue to bear down. If we all do a good job, if we all stick to these measures, we can get an end result somewhere between 3 and 15,000. That is our closest estimate. We will, of course, watch carefully for sophisticated emerging models as we move forward with this epidemic.
Okay, we'll move to the next caller.
Your next question comes from Cynthia Mulligan with City TV. Please go ahead.
Hi, Doctor. Could you spell out more what the average person needs to do? And does there need to be a full-on lockdown? Do the Emergency Measures Act need to be put in place?
So the average person needs to do the things that they have been asked to do. They need to maintain physical distance from others. They should stay at home unless they are an essential worker or when they need to go out for essential tasks. And those essential tasks need to be very tightly defined. So in other words, it is to get food, it is to get pharmacy supplies if those otherwise cannot be delivered. If people wish to go out and exercise, and I do understand why in this situation people might want to do that, it is imperative that they do that on their own or perhaps as a couple or very small group with whom they already live. It is not appropriate if one is out walking to stop in the normal way and speak to neighbors or strangers because you need to maintain social distancing. People need to maintain hand hygiene. They need to wash their hands regularly with soap and water. They need to use alcohol-based antibacterial agents when soap and water isn't available. Those are the most basic personal things that people can do.
I just want to remind everyone on the line to please try and keep your questions to what's on the slides. The Premier and the Minister will be able to answer further questions later. Cynthia, follow-up?
Well, I'm sorry, but my follow-up is, Doctor, Ontario has done, per population, half the tests that Quebec has. Do we have an accurate figure here, or as much information as you need to do these projections?
That is a very good question. And what that points out again is that you shouldn't simply do projections based on test-confirmed cases. It's also important to look at projections which are based on other things. Sadly, in countries that are further on with the epidemic, there are a mounting number of deaths. And in that situation, what you track over time is deaths, because deaths are not subject to what would technically be called testing bias. In other words, to any distortion that might be brought to the system because of the way in which you test. So we have used various ways of looking at this, and so we are confident that the overall mortality that we referred to and the target mortality that we're now tracking towards, that is not affected by the number of tests or the way in which the tests are being done.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, Dr. Donnelly. Just a quick question on the model. I'm wondering about it because, and I'm not challenging it, I'm just looking for an explanation. We know that there are probably hundreds or thousands more people who have COVID-19 that have been tested because not everybody's getting tested. So how many people do you assume have this beyond those who have tested positive? And is there a factor you use? Like, is it 5 times the testing number or 10 times the testing number?
Again, that's a great question. There are some models that actually work on that basis, that, if you like, they make assumptions about how many, if you could call them unknown cases, are out there. And look, let's be honest and frank, there clearly are many cases in the province that we don't know about. That must be the case because the evidence from around the world suggests that many people, particularly younger people, can have this disease in a very mild form. They hardly realize that they've got it, and therefore the danger is that they can spread it to someone else quite innocently. But again, these models, in terms of a worst case projection and in terms of where we now think we are headed, are not dependent upon that sort of data. Modeling and projecting is a very inexact science. In the early days of an epidemic, it's all about providing an important early steer to policymakers about what they should be doing. And that's what happened in Ontario, because as soon as Command Table saw the figures that suggested that there could be an overall mortality of between 90 and 100,000, they moved very quickly to shut the schools, which was the right thing to do. Can I just, through our moderator, just remind journalist colleagues that I do have 2 fellow panelists here with me. I think because the camera is just focused on one person at a time, you might be missing the fact that there are some experts both from the university side and from the health service side who you may also wish to ask some questions of.
Okay, follow-up?
Yes, thanks for that explanation, Doctor. Just quickly, though, what is the factor that you would estimate? You know, we have about, low 3,000s, 3,400 cases confirmed now. What would you extrapolate from that as to the number of actual cases out there?
Honestly, I think that's very, very difficult to say, because that is a product of what your exact testing strategy is at any one time. And there's another factor in Ontario which is important to mention, and I'm sure you're aware of, but that is our returning travelers from overseas. So if I can use particularly the example of the so-called snowbirds, who, many of whom overwinter in the United States and then travel back to Ontario. And of course, that is a very challenging problem for us, and one that we need help from those individuals with. Because I think it's very clear that in many parts of the United States, this disease is highly prevalent. And so many of these people, again, quite innocently, can travel back from the United States and perhaps don't realize that they are carrying the disease. And this is why these people must stay at home for 2 weeks. They must go directly to their home when they come from the airport or other port of entry. They should not be stopping to do shopping or anything else on the way home. Whilst they are at home, they must absolutely reduce to as close to zero as possible their contact with other individuals. I'm sure you all see the importance of this, which is that otherwise these individuals could inadvertently seed this disease all over Ontario. So if you know snowbirds, if you have snowbirds as neighbors, please help them out. Please drop shopping for them. Please drop pharmacy supplies for them. Please help them to do what I'm sure they want to do, which is to keep everybody else safe.
Next question.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Hi, doctors. I wanted to ask about that projection, the 3,000 to 15,000 projection, which I understand the range there depends on the distance measures, what we bring in, and how well we adhere to them. But can you talk a little bit more about how you came up with those boundaries and what level of confidence you have in those boundaries?
Well, those figures relate to the entire course of the disease, which may be, as I say, over 2 years. What people don't necessarily realize is that with an epidemic like this, you can have a second or even sometimes a small third wave. And so if you see figures which are less than this, a lot less than this, it may be because people are only looking at the first wave, or it may be, as Steny Brown was explaining earlier on, that the particular model that he was speaking to is a model that is focused on the short term. All of these models work in a complementary way. The sort of projections that I'm talking about, the 100 down to somewhere between 3 and 15, the purpose of that is to drive high-level public health measures. The purpose of the sort of model that Steny Brown was talking about is to inform the work of people like Matt Anderson and his hospital colleagues in terms of preparing the healthcare system. So I think it might be useful at this point for me to throw this across to Steny to talk about the way that sophisticated model he was referring to operates, and it may be that there's a contribution that Matt would want to make about how modeling actually allows us to take an informed view on issues such as how many ventilators we might need. So Steny first.
I'm not sure I could help on the
No?
3,
Okay.
sorry.
Okay, so anything you want to add, Matt, on the use of models to inform healthcare preparedness and planning?
Sure, and I don't know if it's direct to the question, but as Dr. Donnelly has said, for us, as we think about how do we create the capacity that's going to be required, while we appreciate that the models can move, and as I mentioned in my talk, that first slide, we update that daily to try to maintain a view as to where do we need to get to support the system. As Dr. Donnelly has described, that can move around quite a bit. It's still helpful for us as we think about what is the scale that we need to move to make sure that we're creating a system that can support. And of course, as you've heard, and I think there's been the theme throughout this meeting, where that model ultimately goes, what these numbers ultimately come back to, largely comes down to how well did we do as citizens to adhere to the social distancing. We have that power, and we have to execute that to keep our numbers as low as possible.
Quick follow-up.
And just connected to the point that you were making there, the 18-month to 2-year horizon. Does the model assume the same level of distancing measures, or does it assume that over that time, as we get from first wave to second wave, that these measures are lifted in some way?
Yeah, great question. You're now getting into a very complicated future scenario that truly will require very sophisticated models and the very best scientific brains to look at this. Look, what we're trying to do at the minute is to drive down, as I explained, the effective reproductive number of the virus to below 1. So this is not simply now about flattening the curve. This is about chopping the top off the curve. This is really about taking measures that drive down the number of deaths, the pressure on the health service. And the idea of that is that it not only does those two good things, but it does allow the potential, if you actually completely suppress the disease, to look very carefully around the province and to see whether there are places where it might be possible to selectively lift some of the social distancing measures. I need to say that we are some way off before we could do that. But the time to start thinking about that now is now. The time to start thinking about how modeling could inform that is now. And there are various things that you can do, including background serological testing, because the assumption that most of the world is working to, and we have to believe is correct, is that this is a disease that we will only get once. And so if you do background serological testing, which doesn't tell you about whether you have the disease today, but tells you about whether you've had it in the preceding weeks and months, that can actually be very helpful. Because in a place where there's very little background evidence of infection, you clearly would need to be very, very careful about lifting social measures, because there is still a large proportion of the population who are vulnerable. Whereas in a place, probably more like the GTA, where we have most of our cases and sadly most of our deaths, then it might turn out that when we actually look at this, there is a higher level of background infection. And if enough people have got this disease and are now immune to it, you do effectively move closer towards a situation where you would have what's called herd immunity. And what that does is that it stops the chain, it breaks the chain, because when you have somebody who is infected, most of the people who they come up against have themselves already had the disease and therefore are not going to get it again. So you can see that the way in which you might lift social measures, the timing of when you did that is going to have to be driven by some very complicated modeling, some really quite complicated science, and is going to have to be done in a very thoughtful and disciplined way.
Okay, next question.
Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Thank you. Hello. Does any of the modeling consider the general population donning some kind of mask?
These models have not. In general, the accepted science in terms of masks has been that they really are best preserved for frontline healthcare staff and for other appropriate frontline healthcare providers. I am aware that in some other parts of the world, it has become more and more common for the general public to wear masks. And we need to keep watching the evidence on this and what other places do. But in general, with masks, it's not so much that it protects the wearer, other than in a frontline healthcare setting. It really is more about protecting other people from an individual if that individual is themselves symptomatic. I mean, simplistically, it stops them coughing or sneezing over someone. But of course, the person who is symptomatic, the person who is coughing and sneezing, shouldn't be out anyway. They should be self-isolating. They should be at home. Now, that doesn't mean that if you see somebody with a mask, you should panic and assume that they have COVID. That will almost certainly not be the case, because I think people largely are following, thankfully, the injunction to stay home if they are unwell. But there are differences, national, cultural, in terms of mask wearing. I think masks in our current situation should be preserved for those who need it most, our highly valuable frontline healthcare workers and other emergency workers. Matt, you've been very involved in the PPE issue, the supply chain. I don't know if there's anything you would want to add.
Thank you, Peter. I think I would just add that PPE and supply chain, this is obviously our biggest challenge in our healthcare system right now as we look to our preparations. We have a sort of a significant effort going on federally, provincially, within all of our agencies to secure more PPE. We're also encouraging conservation methodologies across our system. But at the end of the day, and going back to Dr. Donnelly's original point, the most important thing here is the safety of our healthcare workers, the people that they serve, our patients and families, and we move everything in that direction to support them. Thank you.
Follow up?
Thank you. The worst case scenario, the scary number, the 100,000 dead, that seems to be avoided through full social distancing measures for a long time. I'm wondering, are you aware of any jurisdiction that has successfully been able to socially distance themselves for more than a year or 2 years?
It's another great question. Look, I think people need to realize that these are truly, truly unprecedented times. People have tried to think about historical examples when social distancing was requested and complied with. And some people will point back to polio epidemics in the past. But even then, it wasn't on the scale that we're now having to apply. And so when people reach for historical precedent here, they actually have to go back over 100 years. They have to go back to the great influenza pandemic of 1918, when some places did undertake the sort of social distancing and other public health measures that we've been talking about today. The interesting thing about that is that when you read the history papers, and there's a very good one just a few days ago, actually, not written by public health people, written by economists, who looked at the effect of those places in the United States who had gone very rapidly for very rigorous social distancing measures. So in other words, the places that had closed the schools early and taken other necessary steps. And the interesting thing is that there's a huge difference if you then look at the mortality in those states. And fascinatingly, there's a difference in terms of the way that those states bounce back economically. It seems that there is genuinely no dilemma between saving lives and saving the economy. The smart science-based thing to do is to bear down heavily, to protect the vulnerable, and therefore to get through this more quickly than you would otherwise do, so that the economy of your area can bounce back.
Next question.
Your next question comes from Christina Tinalia with CP24. Please go ahead.
Hi there. Thank you so much for taking my question. Doctors, I'm wondering if you can provide some guidance on this. When we consider that Toronto is the largest city in the province, and you look at the projected numbers in terms of the projected number of deaths, can you attribute them geographically? Can you attribute them to, say, because Toronto is the largest city, for example, people in this city could perhaps expect the largest potential number of deaths in Toronto?
So you would normally expect, of course, the largest number of deaths to happen in the places that have the largest population. And it's not surprising, therefore, that the largest number of cases we have and the largest number of deaths, all bar outbreaks in nursing homes outside the GTA, they are focused on Toronto and the GTA. But really the measures that one would take are the same. One bears down heavily whether you're in Toronto or whether you're in a smaller Ontario town. I do think there has been a very responsible attitude taken to try and ensure that federal government, provincial government, and Toronto city government try and keep very tightly in step, because clearly if that were not to be the case, I think the public would be confused if there were different rules in one place than somewhere else. And I do think that the politicians at all of those three levels, drawing on the science, have been very careful to try and stay in step to limit the number of deaths, whether that's in Toronto, the GTA, or elsewhere.
Follow-up?
Thank you, doctors. As the doctors who, of course, have the most information on this matter, I am already hearing, as you're speaking, concerns from doctors about the number of ICU beds. Can you just be clear, will there be enough ICU beds by Monday here in this province, and how quickly do you think the province can ramp up capacity?
So I'm going to turn to my right to Matt Anderson from Ontario Health. He and his team have been doing a lot of work in terms of ramping up capacity.
Great, thank you for the question related to ICU capacity. So as I mentioned in my opening remarks, we right now have a little over 400 beds dedicated and open for COVID cases. We are able to grow that by another 900. That is the number that we have today. In terms of, also I would add that our current capacity across the province is at a little above 70% of our total ICU capacity. That's before we add the other additional beds. What we see, though, is that that number of 70% is averaged across the province. So we do have to look at load balancing, meaning that there will be times when we will need to move equipment to places that need more equipment. Occasionally, we also need to move patients from one place to another to make sure that we've got the capacity required. In terms of your specific question of having capacity at a certain point in time, it again goes back to the points that have been raised by Dr. Donnelly and Dr. Brown on social distancing and managing the disease. If we can keep the prevalence of the disease to a lower level, the capacity that we have online or that we could bring online would indeed be sufficient. But if the capacity was to spike, or the need, pardon me, was to spike, that becomes very difficult for us, difficult to project. And so what we do, in addition to having the 900 additional machines, ventilators, that is, in beds, we're also looking at sourcing more as this disease goes on and as that trajectory is still in question, so we can get as much supply in as possible to meet whatever demands are coming our way.
Okay, we're going to move on, but just a note that unfortunately we're running short on time, so this will be the last caller.
Your final question comes from Travis Daharaj with Global News. Please go ahead.
Hi there, and this any doctor can take this. It follows up on Christina's question. I'm looking at slide 14 here, the ICU capacity for COVID-19. So the green bar is the confirmed number of cases, and we know that in the past, what has been projected and the reality of the situation is not aligned. And it looks as though in the short term, like next week, we may run out of ICU beds. So what is being done to, in the next week, get some of these beds online? And do you expect shortages in the meantime? And how long would you expect shortages for?
So it's Matt Anderson. I'm happy to take that question again. In the slide that you're referring to, there's two lines on there. The first line, which is the current open capacity. The second line is the additional capacity that we can surge up to in very short order. So if this chart were to bear itself out to be absolutely accurate, which I believe my modelers to the left of me would caution that that's not likely that it will play exactly this way. But if it did, we would be able to bring enough capacity online Again, the challenge becomes twofold. One is, does the demand actually fit this curve? And certainly if it's the blue bars, that would be a good thing. If it is the orange bars, that is not a good thing. That becomes much more difficult for us to meet. The second is, what is the slope? We've got this modeled out. It could spike faster, which is another challenge for us for sure. And although I said two, I should say that the third element on all of this is matching where are these cases happening versus where do we have the capacity in the province. That is very difficult for us to model. One of the things that we have done to try to offset some of the risk associated to that is we have a provincial command table that is run by critical care docs and others to make sure that when a area in the province, if they find themselves in trouble, can call this line and we can work together to see, as I mentioned in the last question, is there either equipment that can be deployed to that area, or perhaps are there patients that can be moved to another nearby facility that has the equipment necessary? So there's many different things that we'll try to do to make sure that we've got the ventilator capacity, the ICU capacity in the province. Again, going back to the earlier comments from Dr. Donnelly and Dr. Brown, so much of this comes down to what is the rate of disease in our province? Are we following the social distancing rules? And are we doing everything we can to contribute to keeping the prevalence of this disease as low as possible?
So we know that
last question
has been an issue in procurement in the past, and we know that a lot of healthcare workers have tested positive. As you know, President Trump is using the Defense Production Act to direct 3M to stop exporting masks to Canada. Will your projections change if we're not able to procure some of those N95 masks from the United States?
I think from a modeling perspective, I would have to hand that over to Peter or Staney to comment on whether that would change on the model. Is that?
Do you wish to comment, Staney?
Yeah, I'm happy. So anything that changes the supply that we're anticipating obviously reduces capacity. And as we look at a epidemic growing, that becomes a very, very, very tough place. I think the key issue is whether we're talking about ventilators, or we're talking about beds, we're talking about the people who are actually working, providing care, or we're talking about personal protective equipment. The single most important thing we can do right now is slow the spread of the disease, which then leads to fewer cases. And that's through the types of measures that we've talked about already in place, but also the other things that we can do in the province right now. That's probably the real key at this point, and the single most important thing that we can look at. But as you said, anything that reduces the supply in reduces the capacity we have here.
That's all we have time for, unfortunately. Thanks very much.
Okay, and that is a briefing from public health officials in Ontario. We are expecting to hear from Premier Ford at 2 o'clock Eastern, but he had warned yesterday that some of these projections and modeling would be grim, would be difficult to hear, and indeed it's the first province in this country that has put any sort of estimate or projection on the table when it comes to the number of deaths. The Ontario doctors there also warning that projecting and modeling is an inexact science, obviously, when they're dealing with a lot of unknowns. But the headline for today, certainly, that if no measures had been put in place, none whatsoever, possibly 100,000 people in this province could have died. With the social and physical distancing measures and the restrictions on movement and travel that are in place now, the shutting down of schools and essential services, non-essential services rather, public health officials now say it could be anywhere from 3,000 to 15,000. Again, a wide range of projected fatalities due to COVID-19 again, but another reason, they say, to keep up these important measures of physical distancing to limit the spread of this disease. Premier Ford will be asked more questions about this at the top of the hour. I'm Rosemary Barton. Thank you for watching our ongoing coverage. Andrew Nichols will pick up after this short break.